How do you approach a patient that's been over-harvested in the donor area?
So I think, yeah, that's a really tough problem. So the overharvesting can be of two types. One is general overharvesting of the entire donor region. That is the most difficult to deal with, because obviously they're left with a very thin appearing donor area. They don't have a lot of resources for repair. And then there's overharvesting in a patterned sort of way. So we saw that when the artist robot came out for a while, people were using this tension device that kind of restricted the harvesting to smaller areas, and they would tend to go back in there multiple times, and it would create a pattern. So if the overharvesting maybe is not so egregious, but you notice areas of low density, part of that repair may be to decrease the areas of high density by removing grafts from there. And then one of two things: either if those grafts need to be used on the top of the scalp for repair, then those are available grafts. If they don't need them on the top of the scalp and their primary concern was the over harvesting, and that's the repair that's required, you can actually take some of those hairs and move them back into the donor area to achieve a more even density. So those are two options. The second and third option, or third and fourth option, are a little bit different. So you can also take body hair from various locations. So beard and chest are my two favorite locations to obtain hair from. I've been doing a few cases with back hair as well. That seems to be pretty robust in some patients. And take the body hair and move that into the donor region. The problem with body hair is typically they only have one hair per graft. So to maximize the coverage with the body hair, you want to get the thickest hair possible. So not all patients, have super robust body hair, but typically the beard is a great location because the hair shaft diameters are usually about twice as what you might see on the scalp. So that makes for a pretty robust repair. The second option, which we've been utilizing quite a bit recently, is SMP, scalp micropigmentation. The problem with low density in the donor region and this overharvesting is that you see a lot of scalp. And obviously, if we can decrease that contrast by using SMP, I think that's really been a great methodology to help people that have had graft overharvesting from the donor region. It's also SMP, just while we're on the topic of SMP, it's also a great adjunct for the recipient area, the top of the scalp, to decrease that contrast between scalp and hair. So that's, a non-surgical way to affect some of the repairs that we need to do in situations with low donor capacity.